Now, of course, you can't make the GOP actually do anything to stop Obamacare, but you can opt out personally. We have a solution for libertarians and for Christians. Here it is.
Hey guys, Rob Dew here from InfoWars Nightly News, and I want to talk about solutions. One of the things we talk about a lot on Infowars.com and in the documentaries and videos that we make here is that you are the solution. You have to be part of the solution. If you wait for others to do it, you're going to be waiting a long time. You need to stand up and become active and get involved in the game. One way to do that is by saying no, opting out, like with the TSA, or spending your dollars locally instead of at a big box chain. These are all ways that you can get involved. Well, now we have Obamacare, and this is a big medical tyranny thing. And here's just a little bit of what Alex Jones has to say about Obamacare earlier this year.
Basically, it was a blank check to do whatever they want. Share all your data, NSA the medical records, federalize it, give it to all these corporate interests, kick people off their existing plans, kick people off that had pre-existing conditions, not cover children, lower the quality of care, double, triple, quadruple prices, shut down small healthcare divisions and providers, small insurance companies and HMOs, small clinic chains that help the poor. I come from a family of physicians and healthcare management. I mean, I know about this stuff. And I had doctors on, I had researchers on. The insurance companies bragged that they wrote it. They lobbied to get it passed. The Republican leadership helped write it. And I said, this is a bipartisan screw job, and it's really going to hurt people.
So most of you watching this are going to agree that Obamacare is not a good thing. It was written by the insurance companies, and you know all the rest. But what I want to talk about are ways to get around Obamacare, especially the fees, because starting in 2015, the fees are going to get bigger. In fact, here's what it says on healthcare.gov. If you don't have coverage in 2015, you'll pay the higher of these two amounts: 2% of your yearly household income, or $325 per person for the year. The maximum penalty per family using this method is $975. So if you have a family of 4, you're going to be paying close to $1,000 in fines for 2015, and it's only going to go up. You've seen the articles on InfoWars. We've read emails out from people of others out there who've seen their rates rise or have their plans cut. They've seen prices double. Some people are paying more for their health insurance than their mortgage on their house. But you remember what Obama said.
If you've got health care already, then you can keep your plan if you are satisfied with it.
If you like the plan you have, you can keep it.
I intend to keep this promise. If you like your health care plan, you'll be able to keep your health care plan.
If you like your plan and your doctor, you can keep them.
You'll be able to keep your health care plan.
If you like your plan, you keep your plan.
If you like your doctor, you like your plan, you can keep your doctor, you can keep your plan.
If you like your current insurance, you keep that insurance. Period.
So what do? Where do you go? Is there an alternative to this skyrocketing insurance where it's got super high premiums and deductibles that have been calculated never to be reached? But before we get to these solutions, let's just look at one instance here of insurance companies and their disreputable dealings. Here's what advocate Dr. Margaret Flowers had to say about the health insurance system in New York State. I think looking at our Blue Cross program here, and what they found was that about 1 out of every 5 claims was denied just randomly. Like if 5 claims come in, they just pull one out and say they're not going to pay this one. And we have evidence of this in New York from people that worked in these claim offices, that if there was a certain level area of the city, lower income area, they would deny those claims because they knew people didn't have the resources to fight back. All the more reason to get out of a system that wasn't even designed to help you in the first place. A little over a year ago, me and my wife had the same problem. I saw insurance as a scam. I was sick and tired of paying the high premiums and the deductibles that you can never reach. And then we heard from a neighbor about a program called Samaritan Ministries. It was started back in 1994 by Ted Pinninger from his home in Washington, Illinois. The group has since grown to 36,000 member households participating, and they have around $9 million available each month to meet healthcare needs. They don't consider themselves health insurance. What they call it is health sharing, and here's how it works. Health sharing is a biblical approach to paying for healthcare based on passages such as Galatians 6, verse 2, which says, "Bear one another's burdens, so fulfill the law of Christ." The law is the royal law of loving one another. So each member commits to sending a set share amount each month. These shares are sent directly through the mail from one household to another member with needs. Samaritan Ministries uses a database that randomly matches shares to needs so that sharing is coordinated and that shares go to the appropriate members with the needs. Our share, by the way, is just a little over $400, and that covers a family of 5, and that's what we pay per month. One section which I like on their website is called accountability, which is a word you do not see on many major health insurance sites. So I'm taking money out of this bloated giant bureaucracy that we call healthcare and the insurance system and sending my money directly to people to help them with their medical needs. It's a great way to participate in your community and just help one another. Plus, when you need to use the services, they're there for you. And by participating in this, I get to bypass those Obamacare fines. That's right, Samaritan Ministries and a few others I'm going to mention are grandfathered in, so they're not beholden to the laws of Obamacare. Now, they do have a questionnaire and a few forms they want you to fill out, and they want you to attend church, and you have to have your application and any claims signed by a pastor. So if you don't attend church, you might want to find one in your area. And also, you need to take a long look at SamaritanMinistries.org. It's got all the questions, everything you can answer that I couldn't possibly get to in this report. Earlier this year, we had an unfortunate incident, and it cost us over $600 in medical bills. After filling out the forms and sending everything in, we got over $500 back. And this was our first experience using Samaritan Ministries, but let me tell you, I feel good about using it, and I think you should check it out and really give it a try, and it's a great way to get out of this Obamacare system. So this is one way you can get out of the system, stop feeding it, take away its fuel, thereby taking away its power. It's a great way to do it. Now I'm going to describe a few more here. The article, Opting Out of Obamacare Through Medical Sharing Ministries, focuses on Medishare. Founded in 1993, Medishare historically grew at roughly 10% a year. Since Obamacare passed in 2010, the growth has ticked up to about 15% as some Americans look to end-run the mandate. About 150,000 people are members of medical sharing ministries, and 60,000 of them belong to Medishare, according to Medishare President CEO Tony Meggs. The Obamacare fee exemption requires health sharing ministries to have been in operation before December 31st, 1999. So if you're looking at one that's been around since the 2000s, you may want to take a quick look because they're probably not going to be able to opt out of this Obamacare fee system. So we've looked at Samaritan Ministries and Medishare. The final one here is called LibertyHealthShare.org. They call their system a tried and true cost-sharing method that works. Liberty HealthShare is a reorganization of an existing group that has been sharing costs since 1988. They have been operating successfully for decades because it works. During that period, over $20 million has been shared to meet each other's costs. Medical cost sharing is currently being used by thousands of families nationwide, meeting their health care costs each month. And you can look on their website. They have sections like person-to-person sharing, how the funds are used. They also talk about accountability, which I think is great. And they have 3 different option levels you can get into, so I suggest you check those out and see if they meet your needs. And finally, there's a group out there called greeninsurance.com, which sets itself up as a co-op, and they have a couple membership levels, and they offer to provide up to 100% alternative medicine coverage for services like acupuncture, cleansing, detoxing, even massage. But this site looks brand new, so I don't think it's going to qualify for that Obamacare exemption, but you may want to call them and find out or send them an email. So there are alternatives out there. I'm using one of them, and it works for me. It lets me opt out of Obamacare, and let me tell you, that is one way to defeat the system. Thanks for watching. Be sure to subscribe to this channel and share this video to everybody you know, especially if they're looking for a way to get out of Obamacare. And in the comments section, I'd like you to write if you're using a health sharing service, which one you're using, and if it works for you. And if you're a government-paid troll, please tell us how that government-paid health insurance is working out for you. And if you're interested in taking control of your own health, check out InfoWarsLife.com for our complete line of nutraceutical products. This has been Rob Dew for InfoWars Nightly News. Thank you, and stay healthy.
If you're like most Americans, the Patient Protection Affordable Care Act, also known as Obamacare, is more than confusing. It's overwhelming. And we're going to cut through the confusion of this over 2,500-page mandatory controversial monstrosity so that if you don't have insurance, you can understand what it means and make the choice that's best for you before the upcoming deadline to avoid penalties. We'll also point out the problems and how they became a part of the law. So, this is a sad commentary about how our government operates, and we're going to start with a brief history of how the Affordable Care Act evolved into what it is today.
Yeah, it's an interesting story, Vicki. It's the change we need, right? Remember back in 2009 when President Obama was running for election? The change we need, which included certainly universal health care, single-payer health care system. And that's what America wanted. The doctors wanted it. America wanted it. Congress wanted it. Everybody thought it was the way to go. Something happened. It wasn't in the best interest of the insurance companies or of the pharmaceutical industry for that to happen, because it would have changed their income dramatically.
So how did it become a law?
Well, there was a lot of lobbying that went around, and one of the biggest purchases made to purchase the medical industry was accomplished. What happened is $500 million was spent lobbying in Congress by mostly the insurance industry to convince Congress that they should not have universal health care and that it should be watered down. And that's essentially what happened.
Well, what happened with the timing of Ted Kennedy's death?
Well, President Obama had a lock on the system. He had the majority in both houses, 2/3 majority in both houses, so he literally had free will to do whatever he wanted in terms of legislation. And when he got to a place where we were ready to move into action, Senator Ted Kennedy died. Now, it wasn't a big surprise that Senator Kennedy was going to die because everyone knew he had an advanced brain tumor. However, we weren't so sure that that seat would be filled by another Democrat. So there was kind of a sense of urgency, Vicki, to be able to get this bill passed so it could become law before they lost the majority that was required to make Obamacare, the Affordable Care Act, something that was really universal health care.
So his death made that one
vote.
important vote.
And it's not as though the Democrats didn't know that was happening. It makes you wonder, what were they thinking? Why would they do something to move so slowly that all they really had at that time was a remnant of what universal health care would be about?
Well, so do we have universal health care?
No, we have the Affordable Care Act, which is not about health care reform, really. It's about insurance reform. And of course, insurance reform is necessary, but it also protects the insurance industry so that now they're making more money than ever and have a cushion that's going to bring them lots of profits for some time to come.
Well, you know, this law is called patient protection. So is it patient protection?
Well, in some ways, it really is patient protection because it's going to bring health care to millions of Americans who don't have health care now. And those patients largely are going to be included in the Medicaid program. That's welfare health insurance. It's Medi-Cal in California and it's Medicaid in the other states. And the federal poverty level of income is about $11,500. So we call that 100% of the amount of money that's involved with the federal poverty level. However, there's going to be a ceiling that takes that to 138%. So it's going to be more like $14,000 or $15,000 that's going to be still possible for people to make as an income and also qualify for Medicaid. So with the Affordable Care Act, this new part of the program comes into being. It's a big deal.
Okay, now it's also called affordable. So do you think it's affordable?
Well, it's not going to be affordable for the people who are caught in the middle, particularly from those states where there are Republican governors, of which there are 25, and they have so far not adopted the Affordable Care Act. So there are going to be people who are at the 100% of the federal poverty level, which is the $11,500 of income, and that will not be raised to $14,000, which would bring an awful lot more people into the Affordable Care Act under Medicaid, where they would pay nothing. So is it affordable for them? Not at all if the governors don't participate. But it also isn't affordable, Vicki, because what's happening is when you have insurance that's going to be available and mandatory and you have to pay for it, that's one thing. But when you have large deductibles and copays that people can't afford, first of all, you're mandating that people will have the insurance from the Affordable Care Act. And secondly, giving them an insurance that they can't afford. So we have a real problem here that it's not affordable, especially for those people.
So there's a lot of different tiers about which insurance program they can choose.
Exactly.
And the ones that are affordable to them as far as what do you call it, the premiums
Reimbursements are. What the reimbursements
so
are.
they can afford to pay the monthly fee, but then they can't afford to get sick because if they get sick, they have to pay these big deductibles and copays.
Exactly.
Is what you're saying.
So they might as well not have the insurance. So who benefits from that? The insurance companies, because the insurance companies are now going to be getting money, but they're not going to be having to provide a lot of services. But we have to keep in mind that there are some other positive things here that come from the Affordable Care Act. First of all, there's going to be a cap, okay, on annual health care costs that is no longer enforceable. So people who get sick aren't going to be turned away by their insurance companies because they've exceeded the total amount that can be spent on their health care. That's a big deal.
Well, there were some other things that were going on before that people were talking about too. Like one of them is rescission. So address that.
Rescission's a big one. There, if you have, say, for example, you develop breast cancer, and you've been paying your premiums on your health insurance for 20 years. Soon as the insurance company finds out that you have this, what we have found from our experience in working with them is they may send you a letter and say, we are stopping your insurance. Go ahead and sue us if you want to. And of course, they have all the money in the world to use on defense, and you don't. And that should be banned. And of course, that's one of the things that will be banned.
I think one of the good things that's come out of this is that light has been shed on some of these things that were so unfair, like with pre-existing diseases also.
Oh, that's a really major one. If you have a pre-existing disease today, you may not even get health insurance. But now it's illegal. So this is a big step forward with the Affordable Care Act. And if you have a pre-existing condition, you will pay the same premium as other people your age. So that's a major step forward that makes insurance more affordable for the whole group.
And then also it covers children that are up to 26.
Mm-hmm. If your parents have a policy, you will qualify to be in that policy and covered for your insurance. But if your parents are on Medicare or some other policy that doesn't include children, you're out of luck. But still, it's a step forward.
So with the good, there's also the bad, like, for example, medical records.
That's going to be a very interesting issue because the medical records are going to be electronic. And you think, well, that's great. We'd like to have medical records on an electronic basis because now doctors can get information, right, from other doctors in a very quick way, or from insurance companies, or from whoever has medical records. But they also are going to be, those medical records are going to be available to who? The IRS, Human Health and Services Department, Homeland Security. And it makes you wonder if those records are going to be used for purposes that you wish they wouldn't be, because we know how our government is starting to act when it comes to security.
So there's no privacy.
Well, there's no privacy, and there's a risk they might do something to you that you don't want with that information.
Ouch.
Ouch is right.
Well, there's a lot of politics that went into this also. It seems like they slipped a few other extra things into this bill that really didn't have to do with health care, and this health care bill seems like it's not really health care reform.
Well, do we need 2,500 pages of information that we can't understand because it's written in a way that is not understandable unless you're a top constitutional attorney? I mean, it makes no sense to have that happen. Why would anybody do that? And why would Nancy Pelosi, before this bill was being passed by the Democrats, say, don't worry about what it says, we'll take care about learning it after it's been passed? And of course,
sounds like trading votes or something.
Well, there's a lot of trading that went on with that. And of course, that's a sad commentary again on American politics. We should be doing one issue at a time that's clean. And we need to start working on changing that in Congress.
The other thing is that sometimes people get confused about some of the terminology. So what is the terminology, the individual mandate? Address that.
Yeah, the individual mandate just means it's mandatory for you to have health insurance if you live in this country, if you're here. And that's understandable if we would like to have universal health care, but this is a little bit different. Usually with universal health care, the other 19 industrialized countries in the world are offering health insurance to those people that want it. It's not like it's mandatory. You can turn it down, and you can do private insurance if you want. So a lot of things happened when President Obama told us the change you need is going to be coming forward, because it really didn't.
Also, do people need to know what Enroll America means? What is that
Yeah,
term?
that's a good one. Enroll America just means that it's the program that the government used to provide the Affordable Care Act to those states that are not going to be doing Affordable Care Act policy because they're just stubborn Republicans who don't want to go along with the law of the land. And of course, that's their choice. But it's interesting that the 25 Democratic-controlled governors are bringing Obamacare forward, and the 25 that are Republicans are not. But over time, it'll probably be much the same as Medicare was, and Medicaid, because back in 1965, when Lyndon Johnson passed that in his administration, it took about 15 more years before all the states complied.
So who are the winners and the losers?
Well, the winners right now are the insurance companies, but also the people who are going to get extensions of Medicaid, because now there's going to be another several million people who are going to qualify under the federal poverty minimum wage situation. They're going to qualify for being able to get that insurance, and it will be free. The people that will lose are the people that we're trying to help that fall in the cracks between where the federal poverty level is and where people who can afford insurance begin to buy it. So there's a gap between those people who can afford insurance and those people that can't. The people that can't afford it are going to be buying policies that are mandatory that they can't really afford to pay because they don't have a lot of cash in today's economy that can be spent the way they would like to. And then that's going to cause people to have insurance that they really can't afford and afford to use because of the big copays and deductibles. And that's kind of an oversimplification of what's happening, but that is what's happening.
And some of the money is also coming from Medicare. So the elder are going to be affected.
Well, that's right. Some $500 million or $1 billion is being shunted from Medicare into Medicaid. And I can understand what maybe the government is trying to do there to equalize health care benefits for people, because what we have are a lot of disparities today where people have a lot of money get great health care and people who don't have a lot of money get terrible health care. And it's probably the main reason why America's incredibly sophisticated health care system is only ranked 37th in the world in the overall quality of care.
You know, we've had a history of people going to the ER when they're sick because they don't have insurance and the hospitals have to take them. Will this be changed or affected in some way?
Well, for those people who can't afford health insurance, still, yes, that's going to happen. And you're going to see other people who are continuing to use it too, like immigrants that aren't required to, illegal aliens who are not required to have the Affordable Care Act, are still going to be flooding emergency rooms. So it will be helped some, and it's a step forward.
But the government might be able to attach their wages or take it out of their taxes or something.
Well, probably so, but it's the way it is today anyway, so I don't think that's going to change a whole lot.
So it sounds like that this Affordable Care Act is good for the very poor, but not for the poor.
That's right.
And it's good for the insurance companies, but it's not really a service.
No, that's one of the problems is insurance companies are based on a business where return on investment is what they want.
And that healthcare can end up being rationed.
It could, and you'll see that happening in Medicare to some extent. It has to happen because if you have less funds, of course, what's going to happen is you're going to provide less service.
We're going to have fewer doctors, too.
That's right. So the availability in the Affordable Care Act of healthcare is going to be a big issue. A lot of the insurance companies are only putting out a certain number of doctors who will be available for that, and it may not be the hospital that you want because it may not be covered by your plan. So just because there's a big major hospital down the street from where you live doesn't mean you'll be able to go to that hospital. You may have to travel 20 miles or 50 miles depending on what the situation is. So
well, that's really convenient, especially if it is an emergency.
Well, I mean, an emergency room will always take you, whether you have coverage there or not, so you don't have to worry about that. But the problem is it may not be convenient to drive, when you don't need to, or because you can't get the same doctor that you had before. So we have a lot of adapting to do here. We're going to learn a lot from Covered California, which is the Affordable Care Act in California, and we'll see how that pans out over the next 6 months, because California is a big state. It's the 5th biggest economy in the world. And we should learn a lot about how Obamacare fits into that. So we have to bide our time, see what happens, and go along with the law because it is the law, or face the penalties, which still aren't completely clear. And we'll have to wait to see what that means too. So we've got a new law that has lots of pluses and minuses, and it's going to take time to figure out some of that bottom line. And when we do, hopefully what we'll do is make more adjustments politically to improve the standard of the Affordable Care Act.